Aloha Kelvin Aimoku Kaholokula, a professor chair of Native Hawaiian Health here at the University of Hawaii's Medical School, the John E. Burns School of Medicine. I am a clinical psychologist by training. I was made aware very early on in my career as an undergraduate that there was a shortage, a very few number of Native Hawaiians getting into the field of psychology. I became very interested in the area. And I actually really enjoyed doing research. And psychology is one of those fields where you have an opportunity to do both clinical practice as well as research. I went from direct service more to helping to develop direct services and interventions for our communities. And here at the Department of Native Hawaiian Health, we serve our Native Hawaiian and Pacific Islander communities in several ways. One is many of our pipeline programs into medicine and the health professions are coming through our department, like Imi Ho'ola, which seeks to increase the number of Native Hawaiian Pacific Islanders and other students from socially disadvantaged backgrounds and giving them a pathway into medicine and medical career, as well as the health sciences. The other area that we work extensively on is around health disparities research to address the health inequities that our communities experience. And that range from basic science to applied research, from epidemiological studies all the way to designing community-based, culturally informed interventions with our community partners. And the other thing we do is provide clinical services through our clinical practice here. Right now we have a growing behavioral health program to address the behavioral and mental health needs of our Native Hawaiian and Pacific Islander communities in different parts of this island. Although we're a clinical department within the medical school, we collaborate with so many different organizations. We have a very diverse faculty membership, from physicians to public health professionals to psychologists, even anthropologists at one time, which allows us to really, I think, address the needs of our Hawaiian community as it relates to health and well-being in a very broad way. So we partner with almost all of the community health centers at some point, the 5 Native Hawaiian healthcare systems, Papa Ololoka'i, community hospitals, our major healthcare systems such as Queens, at different ways, at different levels, and conducting research to better address and understand the health needs of our communities. We also provide funding to our community, so we're fortunate to be able to get funding and be able to give out those funds to community partners, as we're doing with now Makawai, which will help us expand what we've been doing for a decade and a half now, in which really to develop the capacity of our communities to better address the health needs of their communities on their own terms, with their own people. We're fortunate that we have such a large community network called the Ulu Network, and there's like 35 plus organizations across the entire āina, from Hawaii Island all the way to Kauai, that are part of the Ulu Network. Our involvement with now Makawai will allow us to continue to reach out to our community health workers across the different islands, enhance their ability to provide services, and in particular address the COVID related needs, right? So with COVID, we had issues with, with the virus itself, the cases, hospitalizations, but there is also the issue of the emotional and economic toll and issues is placing on our communities. And I suspect this will be around a long time, even after we get a better handle of the virus. I mean, for us in the department and for our partnerships, like the one we're having with Papa Ololoka'i, with now Makawai, really is so that we can help our communities better get a handle and address these issues so that we can mitigate them. And I think we have to come together with other organizations to do it, because no one organization can do it alone. We are Pacific Islanders. We have a common history. We have a common aspiration. We have common challenges and common strengths. Our communities were strong. We responded with aloha. It was about others. We complied with all of the public health regulations around wearing masks, social distance, physical distancing, because we knew it was important not just for ourselves, but for others. And it's part of that culture that we have. We've been through this before. Our ancestors have all been through this. It devastated our populations in the 1800s from infectious diseases. So we understand these issues. And so we needed to take charge.